So we had our first ever complications last night since the new regulations. We're very grateful for the guys. So I'm in the clinic. I'm in a hoodie because my midnight last night looked very different to everybody else's. So we had our first complication where a paramedic had injected another paramedic and their chin started to go. Spots, blanching, redness. They knew it was a complication about 2 or 3 hours later. Luckily, they contacted the complications consultant through Faces, and they were able to refer them to us because we got our clinic. This is our clinic. I'll also show you our clinic room, where everything is. It's actually a training room, but clinic at the same time. And then I'll show you where our pharmacy is. See that one? Number 9, there. Luckily, we were able to call our superintendent. He was able to drive in. We were able to come down, open up clinic, open up pharmacy, get the drugs dispensed, and the treatment was able to happen here. So we'll send you some pictures of what that was. But think about what happened. We've got a pharmacist, we've got myself, we've got our oversight clinical manager in, and also, on top of that, we've now got the paramedic and the client. We're able to finish and close up by midnight last night, and I'm just worried that they put a regulation in place that hasn't considered all the cases, and I'm very concerned about intelligent people making simple decisions to complex problems, because it doesn't really fill me with confidence that much thought has gone into it. Sorry I look rough, but this is a complex situation, so wouldn't it be more suitable to educate, train people on how to hold an emergency medication? Now, you don't know if that complication may disappear on its own, may be okay in the morning, but can you really afford to take that risk? And do you want to take that risk when actually the solution to put everybody's mind at ease, to see instant relief, can be administered? I don't understand why we wouldn't be going, right, let's put people on a 6-month training course who are in aesthetics. Let's license the premises so that we know that the premises where it's being held is safe. Like, SPMU artists have to do it. Tattooists have to do it. The aesthetics field is a completely different field other than the occupation that you work in. You can't just say, oh, well, doctors do this and nurses do this. No, you can't just divide them. You all have to come together and treat this as one field. No different than if you go into the nursing field, you have adult nurses and mental health nurses, stroke nurses, diabetes nurses. This is not one size fits all per your occupation. Bring the industry together, put it on a level playing field, do something about it that is going to move the industry forward, not backwards. People saying that this is a great regulatory change. This is a moving backwards policy. Moving forward would mean taking technologies, taking the advancement of people, and we've got 160,000 practitioners, and we guarantee to open our doors 24/7 for anybody who needs help, because this is a clear oversight of what really is happening. We're able to help, and we're not here to push people out the industry. You're here in an industry, and this is what you've got. This is the field of aesthetics. Do something about that field of aesthetics. Move the industry forward. Use people who've got the data. We do 6,000 treatments a day. Of course, there's going to be an increase as that goes up. Last year, we were doing 4,000 and 3,000. Now we're doing 6,000. We're not even at the end of the year. And we're in the summer where it's coming into the worst time of the year for aesthetics. And we're going to have to guarantee to open our doors up, because other professionals, these people who are part of the Be Kind movement, Help Others movement, Look After Your Colleagues movement, are trying to shut the doors on people, not worrying about the consequences, but they are thinking about their back pocket. Sorry, it wasn't chin filler, it's nasal labial filler here around the corner of the mouth towards the marionette, in a passionate rant. Shows I don't know my anatomy. So this was what we got sent through last night. You can see here, the problem that we got is they actually mentioned that they hadn't treated much of the nose to mouth line or the marionette. That actually they just, the nose to mouth. They just kind of come into this marionette and into the top of the lip here. But as you know, that vessels that are coming up through the bottom are leading up through to the nose. So actually it could mean that the blockage is maybe around about here, but it's causing the vessel to die further up. So we're going to have to treat this quickly because you wouldn't necessarily see this type of reaction here. And you can see actually there's some pale and blanching around the top of the lip. So could mean that we've got like a bit of an occlusion or a blockage at this area, something that we needed to treat. So this is when we decided to make the decision that actually we need to come in after speaking to them, and I'll show you the rest of the results. This is it this morning. So this is a message that I got through, just to saying that there's like little flaky scabs appearing, and you can see at the top here, this is kind of coming into a blister. Quite a little bit of bruising here at the top, just from the injections that we did. Ended up using 2 vials of Hylaze on the area. But it was quite, the first one we did as like quite concentrated, and the second one we did as like diluted, so that we could reach further around the area. We believed the occlusion would be somewhere around here, but then we injected slightly higher up, just in case there's pressure on the vessels, into the lower lip, upper lip as well, and then into the lower part of the marionette, just in case the blockage was actually further down, or there might have been several blockages. Unaware, because there was like a bit of a fanning technique involved, which meant it could have been punctured, or it could have been like placed into several different areas. So this is this morning. Let's have a look at the results, and hopefully we'll be all right. I'm very grateful. Actually, I just want to say the guys at Complications Consultant for helping help with this process. You know, they dealt with the initial call and have been involved every step of the way. Holly, who works out there, fantastic. They've got on call. Doctors, nurse prescribers, experts, dentists, like they've got everybody, top level healthcare and non-healthcare professionals who help support that service for incidents like this. This does not mean you are a bad injector. You cannot see through the layers of the skin, and everybody's vascular anatomy is very different. The arteries, the veins, although we have these really fancy diagrams, they are not the same person to person. And this is what I was saying to the paramedic. This does not mean you are a bad injector. You've been injecting for years. You've got good clients under your belt, and this really knocks their confidence. It knocks their confidence to even talk about it because of all the complications that go around about the regulation, this scaremongering. There's people here, and it's almost as if there's a group of people, extremists, who want things to go wrong so that it can end up in the newspaper, so it can end up in the press. As this industry grows, things go wrong accidentally. It's how you deal with it, which is important. Now, I don't care if you're a nurse prescriber, a doctor, a dentist, a beautician, a laser therapist, whatever it is, your skill set, you can never be 100% prepared for what is about to happen in that situation. You need the support of others. And unless you've experienced it before, or you've been around it when a situation's happened, you're going to be very off guard, because normally you work solo as a practitioner. And it's important that you feel like you have people who you can call upon, who are not going to judge you, but are going to help you get out of a sticky situation. And we don't know if leaving this client was going to be okay. We didn't know that. And I don't believe this is anything that we should be getting overly concerned about, apart from if we had the ability where when the complications consultant were there, they were able to prescribe an emergency medication to the client and the practitioner, which could be sent the same day, the next day, immediately, or collected. That would have helped resolve the issue of having to drive down. I had to drive an hour and a bit in the middle of the night to go and help solve this situation. I had to also have our superintendent come in so that we could dispense it on the same day. Why? Because we needed the prescription. We needed it done face to face. Had to be dispensed. That's ridiculous for an emergency situation. But because we haven't thought of every possibility, and like I said, this is a complex problem. I don't envy the person who's got to do it, but you have to work with what's happening in modern day technology. We're moving forward in advancements of technology, AI, how we communicate with people. Most of the news, most of the way in which we communicate with family and friends and everything is done over FaceTime and Zoom calls and Google Meets. But apparently we should resolve this issue by going back to an outdated policy back in 2014 or 4 of how this started with the GMC, rather than going, shall we try and advance this forward? Shall we stop getting outdated regulation and start moving forward with new regulation that supports all occupations? The problem is we're divided by occupation, and it means that they're all sticking to their own communities when actually they all should support one community, which is each other. That's very forgotten, and it's so easy to see. And I was very proud of the whole team. Had a pharmacist, paramedics, doctors and dentists, myself as a nurse, a clinic manager, all there to help somebody. Maybe we should start doing the same instead of being these extremists trying to push a hidden agenda, one that normally lines the back pockets of themselves. There was nothing pleasant except for very costly to try and manage the other night's complication. Get this right. Stop working together. I'm sorry for the rant, but I am exhausted. I'm knackered and constantly battling this drama of occupational hierarchy that doesn't even exist. So this is some great news. This morning, woke up to going to see her for another little checkup. Look at that. This is gone. The scabbing, yes, there's still some scabbing higher up. Shows obviously that's probably where the blockage was, or at least the affected area, because that's where the necrosis was starting. But the scabbing's good, the lips. Also overall, look how good the lips look. They don't look as ducky or pouty. Colours coming back, this is a relief. I'll keep you in touch on what the final result is when I see you later. Excellent. Dissolved. And yeah, just absolutely unfortunately, paramedic going through the issue. This is great. We'll probably just keep in touch over the next couple of days just to make sure everything is. But honestly, this here is the reason why you need to work together in this industry. And it comes from healthcare professionals and non-healthcare professionals who all stand for this idea of standing together, be kind to each other, support each other. And there's loads of room in the industry. I see nothing but bad taste all over the internet.